Well, by now you have likely heard of Wegovy, Ozempic, and maybe Mounjaro.
Well, the medications have become so popular for their weight loss benefits, and now another option has FDA approval. Dr. Deborah Horn with UT Health Houston Center of Obesity Medicine and Metabolic Performance is live here to talk more about this. Good morning.
Good morning.
Yeah, so Mounjaro is widely used for weight loss, but it didn't have FDA approval to treat obesity. Now it does under a new name, though. So tell us more about that. And is it the same medication?
Yeah, I think that's really important. Thanks for asking that question, because patients and individuals thinking about these medications are really confused. So Mounjaro for diabetes and Zepbound for obesity are the exact same medication in a different color pen. And so they have different names for the different indications, but it is the same generic name called tirzepatide. It has the same doses for both diseases.
Okay, so immediately, I think people want to know before they start taking one of these drugs, what are the side effects? Can you talk a little bit about those that have been reported with Zepbound?
Sure. The GLP-1 class of medications, which includes Zepbound and Wegovy, have very similar side effect profiles, and it's the same for our patients with diabetes. GI side effects are the number one. The most common is nausea, then constipation, diarrhea, and then I find in my patients fatigue tends to be sort of number four. But the interesting thing about Zepbound that's different than the other GLP-1s that we have is it actually mimics another hormone in our body, so it's a dual hormone agonist, and that lowers the incidence of those GI side effects. So patients tend to have fewer GI side effects on Zepbound than other GLP-1s.
Okay, well, with FDA approval as a weight loss drug, does that mean insurance may be more likely to cover it? Because some of these medications can cost up to $1,000 a month.
They can be very expensive. I think the efficacy or the ability to drive effective weight loss in Zepbound is going to help with coverage. So Wegovy has about 15 to 18% total body weight loss. Zepbound has about 20 to 22.5% total body weight loss, and a third of people lost 25% or more. So if you think about it, if you weigh 300 pounds, that's between 75 and 90 pounds weight loss on Zepbound. So I think that's going to help. The other thing that's going to help is, at least to our understanding of what Eli Lilly has published so far, the cost of Zepbound is going to be less than the cost of the other GLP-1s.
All right, so something definitely to have a conversation about with your doctor if this is something that you think could benefit you. Doctor, I want you to talk to folks, though, about the risks of starting and stopping medications like these. When you start a medication like Ozempic or Zepbound, are you on that for a very long extended period of time, for life?
Great question. So first, I'll sort of talk about starting and stopping, because I think that's really important. There is a dose escalation, or a variety of doses that you go through to find the dose that's best for you. And the important thing is to do that step by step and not jump around based on availability, because some of these medications are getting harder to find as more people try to obtain access. So talk to your doctor, make sure you're going in the appropriate stepwise fashion. Otherwise, it can aggravate those GI symptoms and make them more likely. The bigger question that you asked that I think is really exciting is, how long do I have to be on these medications if I start them? And that's a question we don't have the answer to yet, but there is a trial that has started, and we're running part of that trial here at the university, specifically using Zepbound, to look at if patients take Zepbound for a year, and everyone's taking the full dose of the medication. And then at the 1 year mark, we move a third of people to stay at that dose, a third of people to go to the lowest dose of Zepbound, and a third of people to go off the medication. How do people respond? We believe that these obesity medicines are like diabetes medicines and blood pressure medicines. If you need the medication and you stop taking it, your physiology is going to push your weight or blood pressure or blood sugar back up, regardless of which medication you're on. But I think we still have to learn about maybe some people's physiology, when they get to a better place from a best weight, best health standpoint, might be able to manage either a lower dose or coming off of their medication. Right now, the FDA has approved them for chronic treatment for chronic disease.
That would be very promising if that study does show that people can go off of it.
Yeah, thanks so much for your insight. Dr. Deborah Horn again with UT Health Houston.
Thank you so much. Have a great day.
You too.